I'm sorry about this, but in terms of delivering a baby and it looked like you tried to hide it, we do have to have the police involved.
And nothing was crying. It came out with nothing.
I know. But the baby's gonna have to be taken for autopsy and there'll be an investigator and everything.
The first thing that caught my eye was the mother's reaction, or lack thereof. Imagine discovering your 19-year-old daughter secretly gave birth and left her child in the trash. The horror should be palpable. Yet an eerie calmness lingers.
And then she said she had to go to the bathroom. She went to the bathroom. She was in there for quite a while. We kept knocking on the door. Finally, we got her to open the door, and there was blood and shit everywhere. She was cleaning it up. Okay. So we took her back to the room, and I was afraid that she knew she was pregnant. She had done something to herself. Mm-hmm. So the doctor started doing a vaginal exam on her. We had the lady come to clean the bathroom. She put the baby in the trash can, and then she put another clean liner over the top of it.
Oh, wow. Okay.
So when they looked in there, there was no trash in there, but it was underneath the clean bag. The baby's dead. Okay, we have him in trauma too, but she killed the kid.
It was a gory, bloody massacre mess.
Could you describe it if possible?
Yeah, there was blood everywhere.
I've never seen anything like that, and I pray to God I never have to see it again.
It's what seasoned medical professionals called a bloody massacre, comparing this crime scene to a horror movie. Brand new body camera captures the unsettling aftermath when a high schooler gave birth in an emergency room bathroom, allegedly killing her newborn son.
I've never, ever seen a reaction like that girl.
On January 27th, 19-year-old Alexee Trevizo was admitted to an Artesia, New Mexico emergency room after complaining of back pain. Her newborn son was later found stuffed inside a trash can in a bloody bathroom she had just used. The high school senior was charged with first-degree murder and tampering with evidence before her graduation.
We discovered a dead baby in the bathroom.
Oh my gosh. I'm sorry. It came out of me and I didn't know.
What did you do to it?
Okay.
Now we're hearing from medical staff who uncovered the gruesome scene after she gave birth.
When I went in there, it was a gory, bloody massacre.
Body camera video shows police officers speaking with medical staff who worked the night Trevizo was admitted into the ER.
She said she needed to go have a bowel movement, and that's kind of when the whole thing happened.
Hospital surveillance video shows Trevizo leave her patient room at 1:38 a.m., waddling toward the bathroom while clutching her back. Trevizo remains in the bathroom for 19 minutes as multiple people check on her.
I knocked on the door and I said, "Are you okay?" And she said, "Yes, I'm fine. I'm just having a hard time going to the bathroom," is what she replied. So I was like, okay.
At some point I went and kind of checked on her, knocked on the door, seen if she needed anything. She denied. She said she didn't need anything.
Did you hear anything?
I didn't hear anything.
Flush, toilet flush?
Yes, after a while I started hearing, so I probably checked on her 2 to 3 times, I'm not exactly sure. And then I just kept hearing paper towel dispenser and flushing and like the water running. And I knocked again, did she need anything? Denied anything. And then eventually it got to a point where I said, "You need to come out." And I asked the clerk to get the key to unlock the door, because obviously she locked the door to go to the restroom. And whenever we finally had the key to unlock it, she opened it and just kind of walked out.
Did she say anything at that point?
She didn't say anything. She was just looking kind of straight past me and went back to the room.
Surveillance video captures that moment as Trevizo leaves the bathroom and heads back to the patient room. It was then that hospital staff got a look at the bloody bathroom for the first time.
And all I saw was like blood everywhere, like on the walls, on the toilet. It just looked like a horror film.
Police speak to multiple people who saw the bathroom, describing fresh blood on the walls, floor, and near the toilet.
The toilet's right here where you're at, and then the sink's right here. It was like up this way, blood splatter. Like,
in your line of work, what would cause that kind of splatter?
I think something that got pulled out or ripped. Like if you rip something and blood just went, it was like once you see the photo, you'll see what I'm talking about. It's just.
So like you say, like rip, like something went like that?
Yeah, like when you rip something, or if you cut something and you go, like you swing your hand and blood just splatters.
Okay, so
That's how it looked.
Oh, so this was fresh to you.
Yes, this blood was fresh. You
And-
could even smell it.
We didn't know what this blood was from. We were a little concerned that maybe she had, known that we were gonna figure it out and that she might have harmed herself or something in the restroom, so the doc wanted to go check her, but obviously that wasn't the case.
Unclear as to what had happened, other nursing staff care for Trevizo, believing she had a miscarriage.
Oh, she came out of the restroom. There was a little trail of blood from the bathroom back to her room. We went to her room. I went to get her undressed. The doctor came in, explained to her that she had a miscarriage. Her and her mom had a back and forth about it.
The doctor said she had a miscarriage?
Yeah.
Okay.
She said it seems, essentially, I'm not sure the exact words, because it was a few months ago, but she said, it seems that you've suffered from a miscarriage, which didn't seem totally abnormal. I've seen awful miscarriages before that are very bloody.
Right.
And so...
Was she bloody?
Mm-hmm.
Like
And then
her
there was,
legs? And
yeah, she had blood all down her legs, and then there was blood in the bathroom everywhere. So
where exactly was the blood and how much?
it was a good amount. It was on the floor.
Minutes later, cleaning staff arrived to wash up the bathroom.
I was called and to go clean the patient's bathroom in ER around, maybe 2 o'clock or so, I think it was the time, I'm not too sure. So when I went in there was blood on the floor, on the wall.
Do you remember which wall?
The one behind the toilet, and then the one on the side right here. There's the one where the toilet sits, back of that.
Yeah.
And then on the side.
Where the call button is?
Yeah.
Okay.
And on the floor, everywhere.
After cleaning the entire bathroom twice, the cleaner grabbed the trash bag to toss it away. That's when she discovered the newborn baby.
When I went to go through the trash, I felt that when I picked up the trash and I looked in it, there was trash in it, but I knew that didn't feel like when I picked it up it was some weight, so I thought it was the trash bags, because we put the trash bags on the bottom. Mm-hmm. And so I started getting the trash out, and then when I did that, I seen that there was a baby in there. And that's when I freaked out, and I called Lori and HT, or the nurses up front, and because there was a baby in the trash. And the baby, when I looked at it, the baby was wrapped up in the bottom of the trash can, and with trash on top of it, in a trash bag.
And so how did you see it, as soon as you picked it up?
No, after I picked up the trash bag that was on top,
Okay,
where
so
they were throwing the trash at, when I picked that up to change it, that's when I noticed that there was, when I seen the baby.
You describe the baby?
Yeah, he was about that big. He had hair, and he was purplish, but still not pink. I don't know how to describe it. He wasn't bruised or nothing like that, and he was purple, pink skin type color.
The cleaner then calls for a nurse who describes the disturbing moment the infant was discovered.
And then when I picked it up, that's when I noticed it even more, because all I saw was black and purple. But once we picked it up, the bag suctioned to his face. And that's when I yelled for my charge nurse, which was HT. And I told him, hey, she put her baby in the trash can. So I handed the baby to him. And he took off to the trauma room and opened up the bag. And then that's when we went and got Dr. Vasquez.
Police then hear from the nurse in charge, who says it was clear early on that the newborn was dead.
I go in the bathroom and she goes, something's in the trash can. I'm like, I looked in there, there's a clean liner. I'm like, what are you talking about? She goes, pick it up. I picked it, I could feel the weight. I knew then we had a serious problem. I just grabbed the trash can and went right across the hall into trauma 2. The liner was pulled out, but there was another trash bag in there in the bottom, but it was all it was rolled up. So I had to tear it apart. And then, of course, I saw the baby in there. So I pulled the baby out, got him on the bed, checked for signs of life. There was absolutely no life whatsoever. I immediately came out of there after I did that, went into the room where she was performing the vaginal exam, and I immediately told her, you have to come out now. And she came out, and we went into trauma 2, and she reassessed the baby. At that time, between me and Chris and her, we determined, there was no reason for us to begin any life saving. The baby was completely gone.